Hello, I'm Dr. Pizzadili. This video is one of my series, Happy Outcomes for Cancer Patients, number 6. These case reports are taken from the book, One Man Alone, an investigation of nutrition, cancer, and Dr. William Donald Kelley, authored by Dr. Nicholas J. Gonzalez, and completed in 1987, published in 2010 by New Spring Press. The research was directed by Dr. Robert A. Good, MD, PhD, the director of Memorial Sloan-Kettering Cancer Center, one of the largest and oldest cancer research facilities in the world. Patient number 6 on page 118 to 128 was a 78-year-old female with metastatic breast carcinoma, and she was alive and healthy 14 years after her diagnosis. That was at the time that the research was done. Patient number 6 is found on page 118 to 128, involves a 78-year-old female with metastatic breast carcinoma. And at the time of the research, she was alive and healthy 14 years since her diagnosis. Now, before cancer, patient 6 had a hysterectomy and her ovaries removed due to what was described as benign uterine disease. You wonder how benign it really was. But in spring of 1973, she found a non-tender mass in her left breast. May of 73, she was admitted to Presbyterian Medical Center in Denver for evaluation. A biopsy confirmed invasive intraductal carcinoma. Not good. So the doctors performed a left radical mastectomy. She lost her breast, and then she was discharged with no additional treatment. And we see they were suffering from the illusion that they had got it all. In mid-1976, patient 6 experienced right rib pain, and this was just diagnosed as muscle sprain. In May of 77, she had a bone scan and x-rays that showed metastatic cancer. In June of 77, the patient began stilbestrol, a synthetic estrogen drug used for breast cancer. So at this point, the patient begins investigating alternatives, including Dr. Kelley's program. Her oncologist does not object, but he states that Dr. Kelley's theories, according to him, are not scientifically founded. In July of 77, the patient began Kelley's program, along with that stilbestrol, ongoing stilbestrol program, and within weeks, her bone pain improved. Within 1 year, all symptoms had completely resolved. And by January of 79, patient number 6 stops that synthetic hormone therapy, which was strongly opposed by her MDs. In July of 79, patient number 6 was examined and she had no evidence of recurrent disease. This is 6 months after she stopped that synthetic hormone. And at this point, her MD, the oncologist, stated that he was concerned that the original diagnosis of bone metastasis was incorrect. He's stupefied by the fact that this woman is now healthy. But that original diagnosis was confirmed by the objective tests, by the x-ray and by biopsy. Well, patient number 6 continued following Dr. Kelley's program. And at age 78, at the time of this report, she reported feeling stronger and healthier than at any other time of her life. And she would periodically return to the oncologist, who says she is the healthiest cancer patient he has ever known. Of course, patient 6 finds these oncologist visits distressing. And I quote, "It's difficult to sit in his waiting room time after time and watch so many patients be destroyed by chemotherapy." Let's look at the facts. Metastatic breast cancer is a deadly disease. the 5-year survival for such cases is 10%. And stilbestrol, the estrogen drug used in this case, does not cure metastatic breast carcinoma. Only 1/3 of those treated with this drug even respond, and in those that respond, the disease inevitably recurs. Only 30% of postmenopausal patients with metastatic breast disease show any benefit with hormone therapy, with the responses only lasting 12 to 14 months. The oncologist in this case never expressed any interest in Dr. Kelley or his nutritional programs, even though he's astonished at how healthy this patient is. And this is a quote: "If Dr. Kelley is right regarding his diet helping in the therapy of cancer, I am sure it will be for the wrong reasons." Does anybody detect a note of arrogance here? So ladies and gentlemen, if you have cancer, you must see that relying on the cancer treatment industry is risky. They are focused on shrinking tumors, not on restoring health. We know that conventional cancer treatment, the chemo and therapy and radiation, cause cancer, and the surgery and biopsies spread cancer. They release circulating tumor cells. Now consider your responsibilities to yourself and to your family, to the people who love you, to the people who depend on you, to the people who want you around. To survive cancer, you must establish these foundations of health. Number one, you must have an optimal body pH, the right acid-alkaline balance. This was established in the 1930s by Dr. Otto Warburg. He won a Nobel Prize for his work. And sadly, our population is very acid because of our food supply and other hazards, and we get more acid all the time. That's not good, and it's setting us up for disease, especially cancer. We must balance hormones. Now, there are so many cancers are hormone-based, like breast cancer, prostate cancer, ovarian cancer, uterine cancer, testicular cancer. Hormone balance is critical. And today we are subject to so many estrogenic chemicals in pesticides, in our food supply. We must detoxify the body and your mind and emotions. So many toxins in our world, thousands of chemicals that didn't exist 100 years ago, and we're being constantly bombarded by these toxins. The mind and emotions, we all walk around with thoughts and emotions that are not constructive and that can lead to cancer. We must eliminate infections. Chronic infections degrade your immune system and weaken its ability to kill cancer cells. We must rejuvenate depleted organs, glands, and systems. I mean, when somebody's diagnosed with cancer, it didn't happen just the day before. Cancer is a chronic disease, and it's often the result of other chronic conditions that have weakened the body, depleted your immune function, and allows cancer to take hold. And then we must use the most appropriate cancer-fighting nutrition to prep your immune system to do its job. Ladies and gentlemen, if you have cancer, get help. Call my office, 907-272-6299. Now, I'm not going to be your medical doctor. You're still going to have your oncologist and your medical doctors, but what my job is to help restore your foundations of health and give you the best chance for your body and your immune system to survive and thrive after your cancer. So I look forward to seeing you, and I look forward to changing your life for the better. Thank you. I'm Dr. Pizzadili.